When I was younger, I noticed that my grandpa used to blink a lot, and what I didn't know about these blinks was that it was actually a form of Tourette's. And these blinks would cause problems in daily tasks, like it was hard for him to read or to drive, and it made him feel uncomfortable in social settings due to people staring. So he really struggled with this on a daily basis. That was until he received Botox, and it really changed his life for the better. Hi, my name is Mackenzie Dreisler, and the career I'll be focusing on today is a cosmetic or aesthetic nurse. So 3 points I'm going to be talking about is what exactly is a cosmetic nurse, what education do you need to become a cosmetic nurse, and how does this affect the lives of your patients? So for starters, what is a cosmetic nurse? Well, found in an article published by registernursing.org, cosmetic nurse is basically what you do to enhance or change someone's appearance for the better. This could be done through Botox, filler, laser hair removal, any type of injection that's not surgical, pretty much. And when it comes to workplace, even though you're a nurse, you're not really going to be working in a hospital. It's probably going to be a medical clinic, even a spa, or like a private practice. There are so many different ways that you can help people through this field, and really you just want to enhance their life, whether it be through something that you can see or can't see. So now that I talked about what a cosmetic nurse is, I'm going to explain the education for it. So for starters, you're going to need a nursing degree. So that can be done through a 4-year bachelor program or a 2-year specialized nursing program. After you do that, you're going to have to pass the NCLEX RN exam. And that's just a licensed nurse because you have to be a licensed nurse first. And then according to the healthcareercenter.com, you're going to need at least 2 years assisting or helping a licensed physician or someone who is already a cosmetic nurse. Someone who is already a cosmetic RN, Faye Asghari, says that she needed to take 5 separate classes to get licenses for procedures that she wanted to do. So overall, it'll take probably around 5 years. However, depending on what procedures and if you want to go deeper into the field, it might take longer and you might need more than just the normal exams. So since I just talked about the education, I now want to talk about the effects that this has on the patients and the people around them. So getting procedures done like filler or Botox, I know there's a lot of stigma around it. Like you can say, oh, that person has their lips done, like why would she do that? Well, she does it, or he does it, or they do it to make themselves feel better. When you get procedures done, you're not doing it for the people around you, you're doing it for you. So being a cosmetic nurse, I get to help that person feel better. And when that person feels better, their life is better. They do better at their job, they are happier, they make great relationship with their friends and family. Overall, it's just good. The whole point is to make people feel better. And I really like having that as a profession where it's cosmetic, which I love if you can't tell, and I also really like the healthcare field in order to make people look and feel better about their lives and who they are. And according to a plastic surgeon, Dr. Shashank Reddy, he actually explains how Botox not only makes you look better and it makes you feel better. He actually talks about how Botox can interrupt the flow to the brain that causes migraines, and therefore it can help stop migraines. It can help joint pain. For my grandpa, it stopped his tics. There's so many there's such a wide variety of things that you can do in this field that can really help people physically and mentally. So overall today, I talked about what it means to be a cosmetic nurse, the education you need, which there is a good amount, and how it affects people's lives. And it really affects people's lives in a good way. And if you're thinking about getting Botox or something done, do it for you. Don't listen to what anyone else says. I mean, learn from my grandpa. He changed his life by doing that, and hopefully one day in the future, I can do that for you.